Hi, I would like to tell you about the Safe Sedation course. We have been running this Safe Sedation course since 2014, and the course is actually accredited by the Royal College of Nursing and the Royal College of Anaesthetists. So it's great news. It's a training that has been accredited. And there is actually a guidance from the Academy of Royal Colleges saying if you are involved in administering or monitoring patients who are receiving safe sedation, then you need to have these core skills. You need to have this knowledge and skills that we have prepared for you in this course. What happens is that there are a lot of people, doctors, nurses, ODPs working in these environments, and they don't have the skills. They have never been trained. They don't have any certificate of having been assessed to have these skills and this knowledge. So maybe you are working in theaters, or maybe you are working in the cath lab, radiology, maybe in a fertility setting, or dentistry, or in emergency medicine, and you are giving drugs or monitoring patients who have received sedation, and you have never received any formal training. So that's why this training is so important to you. And we have been helping a lot of people, from NHS hospitals to private hospitals, small clinic settings to big trusts. So if you are in these circumstances, then this is the course for you. And today I'd like to talk a little bit, give you a snapshot of what we do in the training. So I'm going to share my screen with you. And what happens when we are giving sedation, a big part of administering sedation is monitoring the patient and making sure that our patient is safe. So we don't give too much or too little, and the patient is just in that right amount of drugs that allows him to be comfortable, pain-free throughout the procedure. But the most important monitoring tool that you can have is actually yourself, your brain and your eyes. You are looking at all the monitoring, you're looking at the patient, and you are seeing the data that is being given to you, and you are able to interpret that data. And it's that awareness yourself as being the most important monitoring item in this setting that allows you to implement any measures. So during the course, we also teach you how to prevent complications and how to manage should these complications occur. And of course, that continuous observation and vigilance that is required when you are monitoring a patient under sedation. And maybe you're not aware of this, but a very important monitoring device after you, of course, yourself being present and aware, is capnography. A lot of our students are not aware that capnography is really useful and important when it comes to sedation practice. So I thought of giving you a snapshot of what capnography is. So if you haven't seen a capnography trace in the past, this is what it looks like. So it has these ups and downs. And capnography measures your breathing and the way the gases are exchanged in your lungs. So every time there is a curve, a positive curve, you are expiring. So it measures the amount of CO2 that is expired in your breath. So if you see a curve, your patient is expiring, and then your patient inspires, and there is no CO2 in your patient's breath, and then again, there is another curve. And this is how a normal trace would look like. If we are looking at the patient, and because your patients are talking to you and they are breathing at different patterns, you will probably not see a perfect trace like the one I've just showed you. So you might see something like this. Your patient is breathing at different rates, and you can see here the number of curves. That's the respiratory rate, how many times your patient has been breathing per minute. And here is how deep the breath is. So if your patient gives a big breath, inspires and expires a lot, this curve will be high. And then if you have given your patient some sedation, you can see here that the number of breaths per minute reduces. So your patient is breathing less frequently. And you can see here that the height of these curves is also lower than before sedation. So your patient is not breathing in and out as much air in terms of volume of air as much as before. And here is another possible curve that you may see before sedation. So your patient is breathing frequently, and then after you've given some sedation, you can see the patient has reduced his respiratory rate to half, actually. So he was breathing 4 here. In your screen, you only see 2 curves. And you can see here that the patient is showing some expired CO2 and then shows less. So this patient, if we don't stimulate the patient, he might actually stop breathing. So when we are looking at a capnography trace, even though we are nurses and doctors and we like numbers, we like a number for the heart rate, the blood pressure, a number for urine output to tell us what is normal and what is abnormal. When we're talking about capnography, we cannot just look at the number of CO2 expired. That's of course an important number, but we need to have a look at the curve itself. We need to look at the waveform shape and the respiratory rate. And you look at the waveform shape, the way it looks before, and then you look at the way the curve looks after you have given drugs. And it's the information on how that curve looks like, the information on the respiratory rate before and after, and the information on the expired CO2 that will allow you to make decisions, clinical decisions on how well this patient is doing in terms of breathing. So this is just a snapshot of what we talk about during the Safe Sedation course. It looks actually more complicated than it is. And during the course, you get to practice how to monitor, how to read these traces. And you will actually breathe into a capnograph and see your breathing. So it will allow you to interpret the traces better. And actually people who come on our course actually feel comfortable applying this knowledge the next day, which is brilliant. It's a fun-packed day. So if this is something that you feel would be useful, if you are giving sedation and you need these skills, do get in touch. And we look forward to having you on the Safe Sedation course.